Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's daily bulletin. While dismissing the appeals by the private medical colleges of Andhra Pradesh who had been asked to refund the access tuition fees collected from these students, the Supreme Court bench recently clarified that fee fixation could only be done on the basis of the recommendations and report by the Admission and Fee Regulatory Committee. With this observation, the top court bench comprising of M.R. Shah upheld the High Court order which had dismissed the government order on 6th of September 2017, enhancing the tuition fee for the block years 2017 to 2020 by at least 7 times. Taking note of the delay in the schedule of NEET PG Counselling 2022, the Supreme Court has recently issued notices to the state governments of Karnataka and Bihar, where the counselling got postponed due to different reasons. While the state counselling is pending in these states, already the Medical Counselling Committee has proceeded with the mop-up round of NEET PG counselling for the All India quota seats. Issuing a notice on 8th of November 2022, MCC has notified the students about the reopening of the portal for the fresh registration for the mop-up round of counselling. The portal for fresh registration has opened at 2 p.m. of 8th of November and it will remain open till 11 a.m. of 10th of November 2022. Paxlovid, the antiviral pill that reduces the risk of hospitalization and death from COVID-19, also reduces the risk of long COVID, according to a new study by researchers at the US Department of Veterans Affairs. The study, posted online as a preprint on Saturday, analyzed electronic records for more than 56,000 veterans with COVID-19, including more than 9,000 who were treated with Paxlovid within the first 5 days of their infection. The analysis showed people treated with Paxlovid had a 26% reduced risk of developing several long COVID conditions, including heart disease, blood disorders, fatigue, liver disease, kidney disease, muscle pain, neurocognitive impairment, and shortness of breath. That corresponded to 2.3 fewer cases of long COVID conditions per 100 people 3 months after their diagnosis. Paxlovid also reduced the risk of hospitalization or death following acute COVID-19.
Medications to follow to treat cardiovascular diseases are ineffective as clinicians are rightly concerned that there are too many guidelines with too many individual recommendations to be practical and useful for daily use, particularly in primary care. Typical patients with multiple illnesses require the access to many guidelines at the same time, and some recommendations are not harmonized and often seem contradictory. A new one-stop guideline takes a 360-degree approach to managing heart diseases in Canadian patients with 83 recommendations in one easy-to-use reference. The guideline is published in Canadian Medical Association Journal. Lipoprotein A is a special type of bad cholesterol that is believed to contribute to heart disease, but there are no approved pharmacological therapies to decrease its concentration in the bloodstream. Olpasiran is an investigational drug that reduces lipoprotein A concentrations by degrading the RNA that codes for a protein that is an essential part of the molecule. Researchers at Brigham and Women's Hospital conducted a phase 2 randomized placebo-controlled clinical trial of olpasiran in patients with established cardiovascular disease to evaluate its safety and tolerability and to identify an optimal dose of olpasiran for reducing lipoprotein A levels. The most common anticoagulant used during primary percutaneous coronary intervention is heparin. However, its effects can be somewhat unpredictable, leading to higher than desirable rates of bleeding and blood clots. Vivaloridine is a newer anticoagulant that has more than predictable blood thinning effects. Vivaloridine is a safer and more effective anticoagulant than heparin for treating patients with the most serious type of heart attacks who undergo urgent percutaneous coronary intervention and can lower the risk of death or major bleeding by 31%, finds a study. The study was a late-breaking clinical trial presentation at the American Heart Association's Scientific Sessions AHA 22 in Chicago and published in The Lancet. 1 in 5 people who survive cardiopulmonary resuscitation after cardiac arrest may describe lucid experiences of death that occurred while they were seemingly unconscious on the brink of death, a new study shows. This study was presented during the Resuscitation Science Symposium at American Heart Association's Scientific Sessions 2022 on Sunday, November 6th. Survivors reported having unique lucid experiences, including a perception of separation from the body, observing events without pain or distress, and a meaningful evaluation of life, including their actions, intentions, and thoughts towards others. Researchers found these experiences of death to be different from hallucinations, delusions, illusions, dreams, or CPR-induced consciousness. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.